living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
The COVID-19 pandemic has transformed life as we know it. And this is especially true in hospitals, nursing homes, clinics. They are feeling the crunch even more than the rest of us. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Colleen Roylance. Today we're going to take a look at what's happening in the healthcare industry and what that means for those of us who need healthcare services. Stay tuned. Welcome back to Healthy Living for Life. I am joined by a great panel of experts today. We have Carrie Kaler with St. Peter's. You're the Chief Nursing Officer. Yeah. And we have Heather O'Hara, who's the Vice President of the Hospital Association. And then Sarah Medley, our very own CEO from Mountain Pacific. Thank you all for joining us.
Thank you.
Looking forward to a great conversation. Let's kick it off with this global survey that came out this spring. It has some interesting information. About half of the respondents said that they plan on quitting their healthcare industry jobs within the next 2 to 3 years. Talk to us a little bit about why that is happening.
Sure. We're experiencing that, right here, and I think a lot of it has to do with the pressures. I think people learned a lot from the pandemic about themselves. We all had to kind of go inward a little bit and kind of really retract into what is our purpose, what's our love, what's our passion, and we spent so much time with only our families that I think that we realized that, and healthcare people in general realize that our families are really important, and our own work-life balance, and a lot of what nurses do and clinical providers do in general is we give a lot. And I think that our healthcare workers are realizing that and maybe reframing where they are in their life and what that looks like. And then with the challenges of healthcare and the shortages and just the interesting way society is now, is putting a lot of strain on healthcare providers who just show up to work to help every day, and they get a lot of pressures, a lot of personalities, I guess, and it's starting to become harder, and it's harder to just give when you kind of get a lot of a judgment and pushback for the gift that you want to give.
Mm-hmm. Yeah, that makes good sense. Heather, would you add something to that?
Yeah, I think not only has it changed in our healthcare, our providers and how they look at their work and what they do, but I think our communities have also have a different perspective maybe of what we do in healthcare. At one time, our communities were howling at the moon in support of our healthcare providers, and now I'm seeing a shift. And I think everyone's frustrated, and it's not anyone's fault, but people are having to wait a little bit longer maybe in the ED, or they're having to wait to get into their doctor a little bit longer than they have in the past. And there's a lot of reasons for that, one being workforce, like Carrie mentioned, where there's a shortage of workforce healthcare providers in all areas, not just nursing, but in a lot of different areas. So there's a lot of frustration, and so I see that being taken out on some of our healthcare providers in our industry, which is too bad. So I think it's all of our responsibility in regards to looking at this together and seeing how we, as a community, as a nation, as a state, can come together and come up with some solutions and do it in a positive manner.
Yeah, I think that makes really good sense. So this survey that we are talking about, also very interesting that 71% of the doctors in this survey and 68% of the nurses said that their job has changed a lot in the last 10 years though. So not just the COVID pandemic, but said it's changed a lot and for the worse. So what do we do about that?
So I was thinking about this question, and I've been a nurse now for over 28 years, which is hard to believe. And there's a lot of reasons why our jobs have changed. I don't know if it's for the worse. It's just different. And change is hard for all of us, right? Because it's not what we're used to doing. But I think a lot of it's for good reasons. You know, there are regulatory bodies in healthcare that accreditate us and make sure that we're doing things in the right way that's safe. So a good example is back in the old days when I was a nurse on night shift, you know, it wasn't uncommon to open up that chart and say, okay, what do you think this doctor meant? Can you read that writing for me? You know, whose signature is that? And now, you know, in this day and age, everything is typed into a computer. Our orders are typed in, and there's a reason for that. It's about safety. And so I think we all have to have a different perspective in regards to why some of our jobs have changed. And a lot of it is just because we want to give really good patient care and we want it to be safe and competent care. So I like to twist that around. Yeah, it's changed, but for the most part, it's for the good. So
I think that's a good perspective. So Sarah, from a patient perspective, when you think about the workforce shortage, how do you plan for that? How do you adjust what you do as a patient?
You have to be patient. You have to be a patient, right? Because I think even the issue of specialty care, so you think about the COVID pandemic and surgeries were postponed and specialty care postponed. So now if I were to need some sort of orthopedic procedure or something done to my hip or my knee, I have to wait.
Yeah.
And a lot of people have trouble with that. And I know some of my friends are going through that. And I'm saying, just be patient. You're going to get the care you need, but be patient about it. So I think that's one thing. We all have to have grace and be patient.
Yeah, and sometimes that is hard. We are going to take just a very short break. This has been very interesting. Thank you so much for all that you've told us so far. When we come back, we're going to talk a little bit about the future of healthcare and how we're going to get our healthcare in different ways. Stay tuned. We'll be right back. Welcome back to Healthy Living for Life. We've still got our expert panel with us, and now we're going to talk a little bit about technology in healthcare. So, things have changed because of the pandemic. Telehealth is huge. Can you share with us a little bit about how telehealth is affecting the work that you all are doing?
Yeah, I think that, as Heather brought up before, the reality is that healthcare was changing long before the pandemic. And the pandemic simply, maybe it may come to light, it accelerated the changes that we have to do. And I think really importantly, we as healthcare, we need to embrace all of those different entities out there that are developing technology and AI things and things that we can bring into the healthcare system to improve our efficiency, our effectiveness, and our safety, as well as the quality of care. Because if we are not moving forward, if we're staying the same, we are falling behind.
I think the beauty about some of this new technology, it opens up access. And I hear that a lot at the Montana Hospital Association. That's a priority for all of our communities, is they want to be able to access healthcare when they need it. And telehealth is a great example of how that has opened up so many doors in regards to letting people, talk to a counselor, talk to their doctor, talk to their nurse practitioner, whoever it might be, from their home, so they're not having to drive 200 miles to go see their provider or get care that they deserve and in need. So really, really wonderful opportunity that the pandemic really accelerated. We were doing telehealth a little bit before the pandemic, but it really accelerated it, and I hope it never goes away. I think there's a place for telehealth. So.
I think so too, and in fact, I've heard that providers, as we move forward, are going to have to learn technical literacy, and that's going to be more important than clinical literacy, which kind of surprises me a little bit. But do you think it's going to have that big an impact as we move forward?
I think at some point it will. It's going to be interesting to see how the dynamic changes from really caring about the relationship with your provider, and that it has to be this provider because this person knows me and I need this relationship with my provider, to I don't care who I see as long as it's convenient, it's easy, and it's quick. I'm open, and that's a huge shift from where we've been in the past, I think. And I even look at nursing care and how, we don't have enough nurses. We are not going to have enough nurses for the foreseeable future. And where can that technology and telehealth come into play, even at the bedside, inside a hospital? And already I'm already brainstorming and looking at how can we bring that here to Helena so that family members across the country can be a part of your discharge and can hear that and be on the phone with mom or dad and say, remember on your discharge, Mom, even though you live in California, and you can help support your family members from far away. And I think that there is a big place. And then it also gives us flexibility for our staff and letting them have a better work-life balance so that they can be at home and maybe do some of this work from home and still provide their expertise, their knowledge in our healthcare setting and be there for the patient still in a different way.
I think it's all about a different way. And again, the pandemic, especially in our nursing homes, during the pandemic, at times they weren't able to have visitors come into the nursing home for very good reasons, because that's such a frail population, and it could have been devastating to them to have COVID come into their facility. So they did, there was grants that were out there that nursing homes were able to purchase on their iPads or whatever it was, so they could still connect with their parents or their grandparents or their whatever it may be. And I don't think that's something that we want to do all the time, but it is nice to have that opportunity to, especially for those children or parents from across the United States want to talk to their loved one in the hospital. There's opportunity there, and I don't want that to go away. But there is an important piece, I think, in healthcare that we are dealing with people, and that's why we went into healthcare. It's that relationship piece and having that conversation and whatnot. So I can see a hybrid. I think there's a place for it. Maybe not 100%, but there is a place.
It has been a bit of a silver lining to be able to bring your long-distance relatives into some of these conversations.
Yes.
But I want to go back to something that you mentioned, AI, so artificial intelligence. Talk to me, Sarah, about how you feel about that, a computer determining your care.
Well, I may be unusual, Colleen, in the sense that Mountain Pacific has always been about data and analytics. And so we're very metric driven and outcome based. I would have no problem with it. But I think a lot of folks would, at least my generation would. So I think there's a lot we could do in terms of educating patients, what is it so it's not scary? Because AI sounds a little scary. Artificial intelligence sounds like some robot is making decisions for me, and a lot of us don't want that. But I think there's a place where all of us could educate more about what that might look like.
I think that's fair. Let's go back to something you said, Heather. You mentioned the nursing homes. Now, we've had a number of nursing homes close in Montana over this last year, I think maybe 9.
There's 9 as of last week.
What do we do with those residents when a nursing home closes, and what are some of the causes for these nursing homes closing?
Yeah, so in the hospital setting, that's where they go. So they take up, they're sitting in inpatient hospital beds waiting for placement. So that's also then, the downward effect of that is then it backs up our ERs, and we have patients with longer wait times in the ERs, and that's where we talk about our patients having grace and being patient, because there's things that we can't control inside, and that's that we have nursing home patients sitting there for weeks to months just waiting for placement, taking up a bed that somebody in the ER is going to need. And that is our reality, and that is part of the strain on the nursing workforce and the provider workforce and the frustrations that occur, because they know that these people don't need to be in the hospital anymore, but they take up an enormous amount of resources to care for them, and we love them and we want the best care for them, so we're not going to send them on the street. And so that is kind of the downstream effect of this, and I think that the hospitals are closing, and Heather, you probably can speak to that a lot better than I can, but it has to do with the reimbursement.
Yeah, so in regards to nursing homes and why they're closing, nursing homes have struggled for years, and again, the pandemic just highlighted it. But it's kind of like a three-legged stool in regards to what's going on in the nursing homes. So workforce is an issue. Not only are they having a hard time finding workforce, and primarily it's CNAs that they're having a hard time with, as well as nursing But they're also, you know, the cost of supplies has gone up, inflation, and then they have a set revenue source. So Medicaid is generally the revenue that they get to take care of these patients in nursing homes. And its reimbursement's really low. I mean, they're not covering their costs. They weren't covering their costs pre-pandemic, and they're certainly not covering their costs now because everything has gone up. Workforce, supplies, inflation. So they're finding themselves where they just can't make ends meet anymore. And they're having to make that really difficult decision. And trust me, I've been on the phone with nursing home administrators, and there's tears. Yeah. They have such a dedication to their communities, and they know that they provide a very important service in their communities, but they just can't keep the doors open any longer. And so we're at a crossroads in this state, and it's not just in Montana, but it's across the nation. And it's not a hospital problem, it's not a nursing home problem. It's all of it's the community's responsibility to start putting our heads together and figuring out what we're going to do.
So let's pause there for just a moment. We'll take a quick break. But let's pick that up, the community and what we do to help this situation. Stay with us. We're going to be right back with our panel of experts. Welcome back to Healthy Living for Life. Carrie, Heather, Sarah, thank you so much for staying with us. We kind of ended before the break talking about community and what can community do. And there's been that push to empower patients. Mm-hmm. So what can patients do? Sarah, let's start with you.
Okay, thank you, Colleen. So I think one thing we can do as a community is something that Mountain Pacific is charged to do as part of our contractual work with the federal government. Mm-hmm. And that is form community coalitions that are really focused on reducing readmissions or reducing unnecessary admissions or improving care coordination and care transition, or helping folks who might need nursing home care get alternative forms of care like home health, community and home-based services, even the VA. We've got a lot of veterans in Montana, and the VA system has an outstanding home and community-based service program. So I think thinking about what communities can do through a coalition, and certainly, you know, folks can reach out to Mountain Pacific in Montana about this, and I know that'll be on our website, but that's one thing, Colleen. So that's kind of a Mountain Pacific organization view. So switching gears to patients, I have a personal philosophy that each of us owns some responsibility for staying healthy ourselves. And so I could imagine a world where we're all taking better care of ourselves, we're listening to our healthcare providers, we're exercising, we're doing all the things that we're told to do. Imagine if we did that every day, would we need healthcare as much as we do now? I don't think so. And if we did, maybe we could just have a touch-in with our provider via telehealth, mm-hmm. or remote patient monitoring. I think about that. Mm-hmm. That's another topic that we could explore. There's just a lot of alternatives, and we might not need a full visit with a healthcare provider if we owned our own health.
Yeah, I love that, Sarah. I also think planning early. So even though, you know, my parents are not ready to need assistance or anything like that, but starting to plan for that, like what is that going to look like, and assuming that there's not going to be options, what is my family going to do? Mm-hmm. What are my siblings going to do? What are my parents going to do? And planning now instead of waiting for the moment you're in the hospital and you're told you can't go home. Mm-hmm. That's another suggestion I would have for community. Start having those family discussions. Start having the hard discussions within families that none of us want to think about, and start making a plan A, B, and C, just in case there's not availability.
Which brings also advanced directives and living wills and having those conversations. And then lastly, I would just add that, you know, be a board member, join a community group or be involved in our communities and be involved in the schools. You know, workforce is an issue. How can we promote healthcare in our schools? So I would encourage everyone to get involved. This is our community. It's everyone's responsibility to take care of one another and to have those services in the future. So who best to have that than our community members being involved in and being active, whether it be at the legislature or just in our community councils or whatnot. So
yeah, and Heather, I would add to that is supporting your healthcare systems that are present in your community and all of the entities that are assisting in trying to make that better. You know, there can be frustrations in the healthcare system, and we completely understand that. And we're really working hard. So support your healthcare systems and being better instead of sitting back and being frustrated. Use that frustration in a good way.
yeah.
Can we just say be kind to your healthcare provider?
Yes.
Yeah.
Be nice.
Maybe we can talk about that a little bit.
Yes.
That's a great point.
Yeah.
That's a great
Absolutely.
point. Yeah, and I would say that I've witnessed it, happened to be in the emergency room some months ago, and it was pretty shocking how a healthcare provider was treated by a patient. And the fact that our hospitals and some of our clinics have to have signs up that remind us to be kind is a bit disturbing, because we should want to do that. Our healthcare providers want to keep us safe and they want to make us feel better. So be kind. Yes, absolutely.
Yes, please and thank you go a long ways.
Yeah.
So we've got just about a minute left, and I'd like to give each of you a little bit of time. Any wrap-up thoughts that we haven't talked about yet? So Carrie, let's start with you.
I think that regardless of the challenges that we have, there's so many healthcare providers that do show up every single day to try to make it better and make the effort and work really hard at trying to keep up with the changes and really want what's best for our community. And so just to remember that when you come into the healthcare system, that everybody is actually there for you.
And the only thing I would add to that's really nice, Carrie, is that, you know, having been in the profession for a while, I'm really proud of what we've done in Montana and how we support our communities. And again, we just ask that that you take care of your healthcare providers too. They need that love and attention and support. So we do good things in Montana, and we want to continue giving good care. So to support them.
I love that. I think that's great. The only exclamation point I might put on it is just as patients, take good care of yourself.
Yes.
Mm-hmm.
And really try and be healthier. It's New Year coming up, so it's a good time to talk about that. Think about it.
Yeah. I think those are
Wise
great
words.
points. Yep.
Very good, very good information and advice from each of you, and I can't thank you enough for joining us today. Really appreciate your time.
Thank you.
Thanks,
That was
Colleen.
great. Great conversation.
Yeah, it was fun.
Very
Thanks.
fun.
And thank you for joining. We hope you'll join us again next week for Healthy Living for Life. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Take care.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.